We need to stop thinking of drugs in terms of good and bad. Okay? I think because just about all drugs can be put to use beneficially in some way, and they can be abused heavily at the same time.
Right.
And cannabis is no exception at this point. And cannabis use disorder is real. There's no question about it. People go through withdrawals. There was for a long time this sort of idea that people in one camp, there's no psychological withdrawal, there's no physical withdrawal. Oh, yes, there is. You see it every day in people who are struggling with it. And that's like, who are these people? And then
can you describe it? What are those effects of withdrawal?
Withdrawal, yes. So withdrawal, both psychological, physical. One is the psychological, basically is, this sense of craving. You're just searching for it all the time, no matter you are in some ways neglecting your duties and things, and it's interfering with your responsibilities and everything. On the physical level, irritability, agitation, lack of sleep, increased appetite, insomnia, all of those things can happen to people, and it can last 1 or 2 weeks. After that. And
most people will probably not tolerate the withdrawal.
That's the problem, because I think here's a gray area. And this needs to be understood. Many times people will say, well, if I don't take it, I'm anxious and I just feel uncomfortable. What they're not recognizing is that it's not the anxiety that they're taking it for. It's the withdrawal. That's the anxiety factor. Yeah. And they're just trying to treat their withdrawal.
Similar to a nicotine addiction. Somebody says, I have to smoke, otherwise I'm going to be jittery. Or
correct.
I'm going to be,
Absolutely.
Well, it's the rebound effect happening.
Right. And these withdrawals, there are certain medicines that can sort of play a role in that way. And in fact, CBD has been shown in some substance use, including in cocaine and opioids, and even used in cannabis use disorder in some ways to allay. And one of the factors may be that we know some of its anti-anxiety effects. And we know that when you stop, even before there's any physical component, it may be the anxiety factor. So if you delay that anxiety factor, you may be able to mitigate the rest of it in some shape or form. And that's a very important point that people need to learn and not think of it as that there is no withdrawal, so it's all in my head. And so I can just keep using it every day, no matter what. But, every individual is different. How much they use, how frequently they use, how much the potency of how they use, all are going to play a role in the withdrawal. But withdrawals are not like a alcohol withdrawal. It's not like an withdrawal like an opiate withdrawal, which can be pretty dangerous when you stop. These withdrawals are sort of, if you want to quantify it, less severe than those withdrawals.
They're disruptive and annoying as opposed to medically urgent.
Correct. Absolutely. Yes.
Yeah.
Correct.
Yeah. So how common do you think marijuana addiction is? Would you be able to take a stab at that?
Yeah. I mean, I don't want people to use these numbers as coming, as absolute. But if you look at a lot of data that's been there, overall, anywhere from 9 to 10% or so versus people who have been using it for a long time, about 17, 18%. But there is one meta-analysis that was done recently, and huge actually numbers, more than I think 20,000 patients were in that. And they saw that about patients in the outpatient, about 57% of those people were experiencing withdrawal versus people who were the inpatient, about more than 80% had withdrawal symptoms. So, I see people, I work in an inner city population with severe, persistent, mentally ill people who have comorbid substance use with numerous things. But it becomes tricky because most of the times people are not using one drug. People are using myriad.
Yeah, that's a whole nother story.
Many other,
right.
And that clouds the picture in many ways. But I would say on an average about, you can say 15, 16% or so, would experience
it's a significant number when you consider the amount of users.
Absolutely.
And generally speaking, so the intoxication, so to speak, and the effects. And by the way, I think I want to say, at least from my perspective, you can certainly share your perspective, but clinically, we would say it is considered a problem, whether or not you want to call it an addiction. But there are in the DSM-5 there is language to include some of this discussion about.
Absolutely. I mean, cannabis use disorder is practically addiction. But what does addiction really mean? Addiction is a general way of saying that you continue to use something despite negative consequences.
Right. It's interfering with your life.
Absolutely. If you look at the criteria of cannabis use disorder, which are 11 from mild, moderate, severe. For mild, you need 2-3 symptoms. For moderate, 4-5, and for severe, 6-7 or more. They go from all of the physical ones to saying that, looking for, despite the consequences, you continue to go down this path. You are searching for, you're neglecting relationships, your professional duties, all of this. So it's more or less, yes, it's the same terminology.
Well, and I think people don't want to hear that it's addictive. People, at least in my experience, people are saying there's no way it can be addictive. And even your colleague, Dr. Hill, describes in his book how what a relief it is for people to hear when they're struggling with severe anxiety that's increasingly disruptive in their life. And finally, somebody's to say to them, well, smoking this is temporarily relieving the anxiety, but it is over time potentially making it much worse and possibly leading to a depression. So they can be relieved to hear that, oh, okay, maybe there is a way through this to reduce this and then actually deal with what's making me anxious.
The road to what you're describing is, to me, sort of is the goal. It's the end result. But you have to go down that path. We cannot go down that path if we are not educated as clinicians.
Right.
What does the word doctor mean? Doctor comes from a Latin term, docia. What does that mean? To teach, to educate. Our job is not to give just pills.
Have doctors lost that title, do you think?
I think particularly we have, and a lot has to do with, overall how the medical establishment and the way we are driven and we are asked to conduct ourselves and perform duties in today's managed care and other things, where we really don't have time for many clinicians. I don't put myself in there because I treat people in a very different way where I have time to do that. But I take it as a very serious responsibility that if I'm not educated, I can't educate. And there was a study out of Vermont showing that only 1 in 5 patients could say that their clinician was adequately knowledgeable in terms of discussing with them the pros and cons of cannabis. You cannot, most of the clinicians don't realize when they're discussing the cannabis issue, train has left the station. You are not going to tell people today to say, don't use cannabis. But the patient needs to have that belief in you that you are not scolding them.
Well, that it's safe to discuss this with you.